I was quite nervous about getting into medicine, especially before the med entry course, because especially with the UCAT, it's something I've never been exposed to before. Whereas, you do the ATAR and you see kids in the year levels above you go through it and you sort of know what to expect. But with the UCAT, you've got no idea. It's an unknown quantity. So I was really nervous. I had no idea how to prepare, no idea how to approach it. So, yeah. The med entry workshop especially, and the online training platform really sort of reassured me and showed me that there was a pathway of how to approach studying and preparing for the UCAT. Especially the course, it showed me ways to think about the questions I was being given, and that there was a rhyme and reason to everything I was doing. I had, before the course, done a practice exam, and I just felt like I had no idea what I was doing and that I was just totally out of my depth. But after doing the course, it gives you structured ways to go about everything, and that's quite reassuring. And then you go and you look at the online platform and you see all the exams and the drills you can do, and you can essentially plan how you're going to go about it until June or July when you do have the exam. So having that structure is really reassuring. In 3 words, if I had to describe the workshop, it's clear, it's structured, and it's a real confidence boost for me. The best thing about the online platform is 100% just how extensive the resources are, especially all the practice exams you get, because I think any good student will tell you that you can learn theory and concepts, but if you don't get the chance to apply them with questions, so the practice drills or the practice exams, you're never really going to be able to ingrain it in your mind. So I found that really important. And the other thing with the practice exams that I found so crucial from the online platform was that the UCAT really is a test of your mental endurance. It's not like exams for school where you're drawing on theory that you already know. And so some questions you'll feel pretty comfortable with, whereas the UCAT, every question you really need to apply yourself. And it's really draining. So having those exams and being able to enhance your mental endurance was really important and a crucial aspect of that online platform. I love studying medicine. It's been totally different to anything you do at school, and I think the best thing about it in particular is that you get to apply everything you learn. So I spent the first 2 years of my course learning theory and learning all the anatomy, and this year in my 3rd year of medicine, I've been on clinical placement the whole year. So I've been in the hospital, and so everything that you do learn, all of a sudden you get to apply in real life, and you see how it works. You see how the doctors operate and the teams operate. And so it's fascinating, really. It also can be quite challenging, though, because you are really thrust into the deep end, and you get to see things you normally wouldn't with any other university degree. You're dealing with people that can be really sick, and you get to go to surgery or see how other procedures are done on patients, and that's quite a raw experience, which makes everything so fascinating. So, words of advice for people getting into medicine. I think everyone knows that you have to study hard. That sort of goes without saying. The things that don't get said as much is you need to be able to have a good balance with your life and be able to manage your time effectively. You can't just be studying the whole time. You need to balance that with your passions and what you love doing. And if you do that you'll notice your studies do improve as well. So find the time to balance your ATAR work, your UCAT work, but also your outside hobbies, whether that be sport, if it's hanging out with friends, going to see a movie, just anything that really gives your life a good balance. And the other thing is that you can't just study the whole time. You'll burn out. And if you're just trying to read over notes but you're not paying attention, well, it's not worth it. So getting that good balance is really important. Of course, I'd recommend med entry to my friends. As I've said, the most important part of med entry that I think was really helpful for me was the online platform. I think there's just such a massive range of resources, and that's so helpful because you can just continually do questions. You can work on the things that you think where your weaknesses are, and then you can do the practice exams. And that's what really stood out for me for med entry, is that. So yeah, I'd 100% recommend it. No one in particular at med entry inspired me, but one of the things that med entry really encourage is that you study with friends and work with friends. And so I had another friend who was also doing med entry, and so being able to share the experiences of your studies with each other is really helpful, especially because it's a test that like no other, and it's something that not many people can understand. So if you can really sort of bounce off each other and empathise with each other, that was extremely helpful for me in terms of my UCAT studies. Before the med entry interview workshop, I was quite nervous about the interviews, especially I think because with the interviews, it's something where you really have a limited amount of time. And so when you walk to the door and you're about to start that interview, you don't really have much time. And so it's not like an exam where you can leave a question and then come back to it later. Like, you need to be able to answer it then and there, and really not stuff up. And so that sort of played on my mind a bit before the workshop. But the workshop gives you, once again, like the UCAT workshop, great structure into how you can approach questions and situations that you're given. And so when you do that, you just feel a lot more confident going into the interview, thinking, yeah, I know how to deal with this succinctly and to get the best answers out of me. So I think it was really just the confidence boost that the workshop gave me. So I haven't had much experience with other preparation companies, but in terms of what I think med entry would be different compared to these companies, definitely the online platform is the main thing. Having so many exams and so many drills that you can do, it's crucial. And if you're not getting that, like other companies may not be giving you that, then you really can't get the best out of yourself and be fully prepared for that test on the day of it. Outside of the UCAT and the interview training, med entry really helped me with being able to balance my life in Year 12, especially because they give you a rough guide of how much you should be studying. So if you use those guidelines of, all right, I need to do this much work for my school studies, I need to do this much work for my UCAT studies, and you use that as a guide, you can then work out, okay, I've now got time to balance my life with sport or seeing friends, and you don't get worried that you're not doing enough work or that you're doing too much work. So med entry really helped from that point of view of being able to balance my life and not overwork myself but not underwork myself either.